Welcome to This Explainer. Today, we're putting on our detective hats to investigate a silent thief that literally steals mobility as we age. We are looking at a vascular condition that hides right in plain sight. It perfectly mimics common aging complaints, all while secretly causing some pretty severe damage. So get ready, because the clues are absolutely all there if you just know how to read them. Think about this for a second. A staggering 20% of people over the age of 80 have a hidden condition called peripheral artery disease, or PAD. That's 1 in 5 people, yet so many of them never even see it coming. What's even wilder is that while it's a massive cause of painful walking, terrible wound healing, and even amputations, it stays incredibly underdiagnosed and undertreated. Section 1, the hidden leg mystery. We're separating normal aging from actual disease. We all tend to blame everyday aches and pains on just getting older, right? But we really need to draw a hard line between two incredibly similar sounding terms here. First, there's arteriosclerosis. That is literally just your peripheral arteries naturally getting a bit more rigid as the years go by. It's totally expected. But then you've got the real culprit, atherosclerosis. This is the dangerous buildup of fatty plaques inside those arteries. So while stiff pipes are just a part of normal aging, this fatty plaque buildup is a totally different beast entirely, and it is the primary driver of PAD. And that leads us straight to our prime symptom, a condition known clinically as intermittent claudication. Imagine you're just out for a nice walk, and suddenly, bam, your calf seizes up with this intense, burning ache. You stop, you rest for a minute, and the pain just vanishes like it was never there. That is intermittent claudication. It happens because your restricted blood flow simply cannot match your muscles' demand for oxygen while you're exercising. But here's the crazy plot twist, and honestly, this breakdown perfectly explains why PAD is so notoriously underdiagnosed. You would assume everyone with this disease gets that classic walking pain, right? Wrong. Classic intermittent claudication is actually super rare, only showing up in 10 to 30% of patients. The vast majority have atypical symptoms. Or, incredibly, up to half of all patients show absolutely no symptoms at all. They might just subconsciously start walking less to avoid the discomfort, never once realizing they're dealing with a major vascular blockage. Moving to Section 2, clues in your legs. Let's investigate the symptoms. Since that classic textbook pain is missing half the time, you absolutely have to know what else to look for beyond just muscle fatigue. We are looking for sudden, extreme coolness in a limb, which is a massive red flag for dropped blood flow. You want to watch out for weird, unexpected skin discolorations too, like extreme paleness, redness, or even a bluish tint. Keep a close eye out for non-healing leg sores, ulcers, bulging veins, or swelling in just one leg. These are the subtle little footprints that PAD leaves behind. If you're a clinician playing detective, you've got a very precise checklist to interrogate these clues and figure out exactly where a blockage is hiding. First up, you ask about the claudication distance. Exactly how many blocks can they walk or stairs can they climb before the pain hits? Has that distance suddenly dropped? Second, you carefully check for those sudden temperature or skin changes we just mentioned. And third, you assess for night pain. If the pain is literally waking someone up at night, or if it actually hurts more when they prop their legs up, well, that's a huge warning sign for severe ischemic rest pain. Now, listen closely to this critical medical warning straight from the source data. If you even suspect you have PAD, do not reach for compression stockings. It might seem like a natural fix for aching legs, but trying to treat these specific symptoms with support hose can actually make things much, much worse. Why? Because they physically squeeze the leg and further choke off the already restricted arterial blood flow down to your feet. Just don't do it. Section 3. The usual suspects. It's time to map out the risk factors. To catch our culprit before it strikes, we've got to look at the usual lineup of traditional risk factors. We've got hypertension, high cholesterol, obesity, chronic kidney disease, and yeah, even depression. But the absolute heavyweights here, cigarette smoking and diabetes. The clinical data is crystal clear. Smoking and diabetes are incredibly strong risk factors. In fact, they are even stronger predictors for peripheral vascular disease than they are for heart disease. And speaking of smoking, we need to talk about the number 16. It's a really stark wake-up call. Alarmingly, if a person started smoking cigarettes at age 16 or younger, their future risk for developing PAD literally more than doubles. The vascular damage starts way earlier than you'd think, and it just relentlessly compounds over the decades. And the plot thickens right down to our actual DNA. Genetic detectives used data from the Million Veteran Program and pinpointed 19 specific gene loci tied to PAD. What's fascinating is that while many of those overlap with regular coronary disease, 4 of them are completely specific to just PAD. And those unique genetic markers, they strongly link the condition right back to smoking and thrombosis, or blood clots. It highlights exactly how crucial quitting smoking is and hints at why future blood-thinning therapies might be the key to treating this specific disease. Section 4. The gender gap. Let's uncover how PANDOD hides in women. This is where our mystery gets incredibly frustrating. This disease operates entirely differently depending on whether you're a man or a woman. Men are much more likely to show up with those classic textbook symptoms we went over, which means they usually get earlier evidence-based interventions. But for women, totally different story. Women's symptoms are far more likely to be completely asymptomatic or highly atypical. Because of that, their pain gets completely misread as just arthritis or peripheral neuropathy. That leads to a seriously delayed diagnosis and ultimately much more severe disease by the time anyone actually catches it. The clinical text also points out specific high-risk accomplices we need to watch out for in women. Things like the early onset of menopause, specifically before the age of 45, and osteoporosis. These aren't just innocent bystanders. They're shown to actively increase peripheral plaque volume and speed up overall PAD progression in older women. Section 5 brings us to inequality in PAD care and the serious disparities in diagnosis. We absolutely have to talk about a glaring systemic failure in preventative care. The data is undeniable. Black Americans face roughly double the prevalence of PAD compared to non-Hispanic white persons. And that holds true even after you adjust for those traditional risk factors like smoking and diabetes. Yet, despite having double the prevalence, Black Americans are significantly less likely to actually receive timely preventative care and the appropriate treatments. I really want to emphasize this exact powerful phrasing straight from the clinical text. It states that differences in outcomes are clearly attributable to differences in the approach to preventive services and treatment intensity, not to biological, racial, or ethnic differences. Basically, the devastating outcomes we see, like much higher cardiovascular mortality and limb amputation rates among Black Americans, are driven by a systemic failure in equitable care. So, what's the game plan? How do we actually solve this mystery and stop this silent thief? Well, the immediate solution to close these massive health disparity gaps is comprehensive screening for all aging individuals, specifically targeting those high-risk demographics. And the absolute best tool for the job is the Ankle Brachial Index, or ABI, test. It's the first-line, totally non-invasive test for PAD. It simply compares the blood pressure in your ankle to the blood pressure in your arm, and it can instantly spot if there's a blockage hiding in there. So, as we wrap up our investigation today, we've seen exactly how PAD hides behind the mask of normal aging, how it completely ignores the textbook symptoms, and how it quietly ravages vulnerable groups. The next time you or a loved one gets a weird, unexplained leg cramp, or you notice a sudden drop in the temperature of a foot, what are you going to do? Are you just going to write it off as another sign of getting older, or are you going to uncover the clues and ask your doctor about an ABI screening? The mystery is solved, but the next step is entirely up to you.